So, welcome everyone, and it's great to have the first seminar of 2023. Wow, we're in 2023 at the moment, and it looks like the years are passing fast. And somebody was telling me, I like asking myself, I'm getting older, Christian. I think every time I have another year, it just makes you reflect more. Well, either way, it's great to have everybody here today, and thanks everyone that has been involved in this seminar series over time. It's been going on for quite a while, and we've got great feedback, and people have been involved. And I think last year we had so many informative seminars, and thanks for everyone that has contributed in any way that they have done. But today we're going to be having something very, very distinct, something very innovative as well. But before I talk about it, of course, I would like to tell everyone, feel free to introduce yourself. Some of you I know, some of you I don't. So feel free to use the chat to tell us where you're coming from and at least let us know where you are. It's very possible that some of you might be in different, don't worry, it's being recorded, isn't it? So we can be in different parts of the world. So just let us know who you are and where you're coming from, and that will be great. And I can see Timmy is saying, Happy New Year, everyone. Yeah, and Happy New Year to you, Timmy, as well. So feel free to use the chat. The rules of engagement for many of you that already know, it's Zoom, so please try to mute yourself if you're not talking. And if you want to use the camera, like I said, please feel free to use the video. It's always great to place a face to the name. That will be good. But like I always say, it's not a do or die. So it's a virtual seminar. So if for any reason you have to leave your house, if there's a fire, okay, I think the ambulance people are on strike. Hopefully, we're not in Scotland, is it? So if there's any reason that you need to leave, please, you have to, you can leave, and that's what I can say. So today we'll be looking at a distinct seminar, and it's about policy, devising measures in crisis management, a study of the COVID-19 pandemic. You know, the pandemic is strange, isn't it? It's almost like 3 years now I've been talking about this. And what have we learned from the pandemic? How do you manage crisis? And beyond that, one of the things that we have noticed in the world today is that we are facing a crisis, whether we like it or not. It has become almost like a buzzword. I spoke about the ambulance crisis at the moment. There's a strike. There's a series of strikes going on. An inflation crisis. So crisis has become so important. How do you manage crisis is very, very key. And we have an expert in the house today. His name is Dr. Isuru Koswatte, and he'll be telling us much more about resilience building and crisis management. But before I let Isuru talk about it, I would like to tell Isuru thank you, because when I reached out to him about doing this, he was like, yes, Christian, I'm going to do this. You won't believe that Isuru had to fly in from another country today, and he's just arriving just to get this done. So I don't think he has even removed his target yet. But he's trying to get it. So I really appreciate your commitment towards getting this done today. But for those of you that don't know Isuru, I'll just read a short biography of who Isuru is. So Dr. Isuru Koswatte is a lecturer in the Business and Management School, or in the Division of Management Organizational People of the University of the West of Scotland. He's also an adjunct senior research fellow at NSBM Green University in Sri Lanka. He specializes in organizational resilience, global value chains, and business sustainability with active international collaborative research. He completed his PhD from the University of Manchester, and he is skilled in mixed method research, also in structural equation modeling and qualitative research. It's very rare now to see somebody that can do both, so well done. He was also part of the Nordic Research School of International Business Research, which offers several doctoral courses in international business at several schools, like University of Manchester, Copenhagen Business School, Uppsala University, and so on. Before he joined our prestigious university, he was the head of research at NSBM Green University in Sri Lanka. His teaching comprises of a range of models in the fields of business and management, including international business, strategic management, and research skills. So that is a snapshot of Dr. Isuru Koswatte. So I will let Isuru take the center stage, and he'll be discussing much more about policy devising measures to crisis management, a study of the COVID-19 pandemic. Thank you very much.
Right. Thank you very much, Dr. Christian, for that introduction. And I would like to wish all my colleagues a very happy new year. And it's great to be here. And I really appreciate for all of you for giving me this opportunity to speak on policy development for crisis management. So without further ado, let me just share the screen. I hope you are able to see the screen. Perfect. Okay, so this particular study is part of a study, overall study group rather. So this was the first study that we conducted. Again, this was done with a colleague that I work with from Curtin University, Australia. And the sort of idea behind this particular study, the overall study, was to again look at how the COVID pandemic has impacted. Obviously, this is something that has been in research for some time. So this was a study that was done again in the very beginning of COVID pandemic, and sort of we have now got to the second stage of the sort of study where we have now looked at a bit more of the community side of things. So this was the first study, and I would like to sort of discuss some of the findings that we initially were able to identify. Some of the things might be quite close to you in terms of the points, but some things might be slightly different since the context of the study is from South Asia. So let me just introduce to you how we sort of go about with this particular study. So basically, we are going to look at things such as crisis management. And again, the main topic in this particular study was about governance capacity and governance legitimacy, which I will brief you very quickly. And again, we get into the topic of how resilience building is important in this particular study. And then in terms of what the context of the study, again, the theoretical underpinnings, and then what were the initial findings of this particular study will be discussed. Right, so in terms of crisis management, again, I think this is a topic that is quite close to most of my colleagues here, since you're from the business school. Again, it is a situation that we deal with. Again, unexpected events do occur at all times, and sometimes we are sort of led to situations into how we can control this kind of a situation with minimum amount of damage. And crisis in itself is a topic that sort of discusses from multiple bodies of study, but the most important thing that we need to understand is how we can take certain actions to sort of curtail the difficulties surrounding it. And again, pandemic situations have happened in the past, but what sort of differentiates COVID from other pandemics is the global impact it has had. I mean, whether you are part of the UK or other parts of the world, I think it has had a very similar impact when it comes to social and economical impacts. And this is where most of the research has caught its attention and looked at different ways in which you could tackle. And at the same time, although many of the sort of research had looked at it from the business side of things, individual side of things, I think one of the most important things that you need to understand is policy, as well as how governments do sort of look into such situations. And this is where the study was initially developed. With my colleague and again, a few other colleagues, the initial plan that we had was to again look at a situation of a country which is tackling COVID pandemic at the very beginning of the 2020s, and see how they sort of went about in terms of the policy side of things. And again, when we look at the few countries, I will get into this topic a little later on, we see how Sri Lanka came about as the topic that we thought was, or the context that we thought was to be the most important. And again, when we look at how policy side of things are sort of looking at crisis management, the two most important sort of dimensions that were coming from literature was this idea of governance capacity and legitimacy, again, which I will brief in the next couple of slides. So again, when we look at the topic of governance capacity, on a basic level, it is almost a systematic process in which we can look at and analyze certain problems and provide creative solutions. And again, we are looking at diverse players who are part of this process. And again, it is not simply about communicating the issues, but again, how we can maintain a consistent sort of level of relationships between the different domains and functions. And again, governance capacity do include areas such as delivery capacity, for example, again, things such as how we can identify a crisis, how we can look at certain organizations which are trying to control a crisis, and again, how these vulnerabilities could be mitigated in the future. So it is almost sort of a concept that is aiming to explain a crisis in more of a macro level process. And again, when you look at governance legitimacy, on the other hand, it is also, again, touching on some of the similar concepts, but again, we are mostly focusing on the sort of stakeholders and how certain relationships are being maintained. And again, in this particular topic in itself, why this is important is because it discusses about how a certain government could maintain its relationship with relevant sort of parties, especially citizens of the country. And again, the legitimacy at a basic level could be understood as the level of acceptance of a certain community in terms of how a certain government is responding, whether it can be a crisis, whether it can be a simple policy decision. So this is where I think the interest of the topic has come about. And again, this is a topic that is being in discussion when you look at COVID-19, especially in countries, in the Nordic countries where legitimacy and capacity has been discussed. And again, when we dived into the literature, what we found out was that there were certain understandings that was already there, such as, for example, when you look at legitimacy, we can see that the concept was delineated using things such as the input legitimacy, throughput and output, which was again coming from most of the Nordic understanding. And one thing I must say, when we look at the literature standpoint, at the very initial stages, we found that many of the literature was driven purely through the empirical findings rather than it having its own sort of literature body embedded. So that is again giving us more indication as to there needs to be great amount of deeper research in a theoretical lens to be done. So with this understanding, again, since we are discussing crisis, I think it's very important that we also look at how certain organizations, rather governments in this case, or policy development bodies, were able to overcome certain crisis situations. And again, when you look at the pandemic, there were certain countries which was able to sort of organize themselves to a certain level where they were able to mitigate certain issues. They were able to sort of plan ahead compared to many of the other countries. So again, similar to the lens of business, where certain businesses are able to sort of do better, I would say, rather than some other businesses in a certain situation. This is where the topic of resilience building also plays an important task, where we are able to identify what are the kinds of organizations and what are the characteristics, more importantly, these organizations have in order for them to be more successful than others. And again, in terms of resilience building, we were initially looking at the understanding of the pandemic, and again, how economic resilience and financial strength was built, again, purely because we are looking at this from a policy standpoint, where governments were expected to not only take certain measures, but also provide certain financial assistance and support for the individuals who are vulnerable. So again, resilience in this particular study was mainly looked at from the financial side of things, keeping in mind that we are looking at it from the governance and the policy side of things at this point in stage. So again, similar to crisis management, resilience also is a topic that is obviously coming from a few areas. Again, you could define it from multiple ways, but again, for this particular study, we wanted to keep the scope in that financial dimension. So again, why I wanted to summarize that briefly for you was to again show why this study is important, or what made us really look at this policy side of things. Again, the pandemic, when obviously it happened in the 2020, mostly we were looking at it from the business side of lens. And again, there was significant need for research to look at how governments were planning things out. Again, this was not something many countries have had practice before. So different countries or different regions had their own kind of way in which they dealt with. For example, certain countries let the health experts decide many things, but in certain other countries, we saw many different specialists from respective different areas, whether it is the military, whether it's the healthcare services, or whether it's the political powerhouses were sort of put together to provide decisions. So it was quite an interesting mix of things when you look at the literature or the evidence. And one thing that we sort of identified was that when we look at policy side of things, this idea of legitimacy and sort of capacity was already established, but how that sort of leads to governments performing, or how that leads to long-term resilience building, was something that was still emerging. Hence where, again, our expertise was used, and we believe that that is where this was heading. Again, when we were doing this in 2020, we were thinking, yes, immediate solutions were needed, but then again, long-term sustainability of some of these policy decisions were also needed to be taken into account. And I think that adds more value presently, because many of the research that are looking at the pandemic related things now look at how sustainable were some of those strategies were in the long run, and whether those changes that were done initially could be maintained for the future as well, for any other future crisis situation. So that is where I think the study was shaping up its importance. And again, naturally, when we're looking at different regions, again, based on the understandings, again, Sri Lanka emerged not simply because it was quite ideal for many of the research that we're conducting, but also it was one of those countries that did show a significant amount of promise. Again, according to some of the UN findings, it was one of the few countries in the very early stages of the pandemic were able to control the numbers and keep the initial sort of the rapid spread of the virus at a controllable level. So again, it was one of those countries that did show promise as to, okay, there is something there in terms of the policy side of things that they were doing that needed to be explored. And again, diving a little bit in detail in terms of what they did, again, the country established what we call a task force. Again, as I explained, administrators, specialists, different people from different areas were coming together in terms of making the decisions. So hence where I think the policy side of things and how the decision-making process went about showed a promise to expand further as the context of the study. So based on all this understanding, what we sort of derived was that, yes, governance capacity and legitimacy were the two sort of driving forces in terms of the policy side of things that was derived. Again, legitimacy allows the parties and authorities to provide sort of a conversation. Capacity is purely, again, understanding whether they have the resources and they are able to learn through mistakes to derive or face a crisis. And sort of both these dimensions were inferring that in the long run, this is where I think we were trying to really expand our understanding or our expertise onto this and map it further, was to whether this allows maybe governments and certain policy makers to build resilience in the long run, not just simply addressing the pandemic in itself, but then long term, whether these decisions made sense to be continued. And this is where we were sort of expanding our understanding. So in terms of the methodology, again, we were sort of looking at a mixed method research. So initially we conducted several interviews and then we sort of expanded this in terms of a quantitative study. And again, the study sort of mainly was using a sort of convenience sampling at the very initial stages, because it was something quite new. And again, we wanted to get a feel for some of the things, and this is where the interviews came in handy. And again, when we're looking at the population itself, we were looking at three main areas: the education, tourism, and IT sectors. And again, why these sectors were selected? Because again, in the context of South Asia or Sri Lanka in particular, these were the sort of three main sectors that the United Nations and the World Bank have identified as to be the most strategically important in terms of the economic standpoint of the country. And hence, as I said before, we're looking at the economic resilience. Predominantly, we felt that this was something of a significant importance. And again, we went about with exploring the interviews in detail with NVivo, and again with the survey, we looked at how these results were sort of mapped in terms of a better understanding. So in terms of the qualitative findings that we were able to gather, it was quite interesting, because most of the areas, as I said, when we were looking at this from the theoretical lens, at the beginning of the study, I would say that the theory side of things were not as strong as it was for certain other areas like crisis management on its own, again, purely because most of the research surrounding the policy of COVID in the 2020 obviously was derived through its own sort of context. For example, there was one study that was quite interesting that was done in Pakistan, and another study that was done in Norway, again, very context specific dimensions that we were able to sort of look into, but then we were then now trying to sort of map certain ideas in this South Asian context. So this is where I think it was quite interesting for us to really dive into the qualitative dimensions. And based on this idea, we were able to sort of map out or identify 4 key themes that I would like to say: political capacity, stakeholder involvement, input development, and throughput development. And again, when you look at things such as political capacity, again, the lack of rules and regulations in the sort of way in which certain things were handled, again, whether it is politicians or sort of other individuals who were in powerful positions are sort of exploiting, was something that was predominant, that was not really helping the cause of aiming to control some of these threats that were surrounding the pandemic. Again, as I said, despite the country having a certain mechanism, I would say, at least on paper, to have experts coming in and sort of looking at this issue. Unfortunately, this didn't seem to continue as per the ideas that were coming from the interviews. Again, people felt that this involvement that was seen at the very beginning was lacking as it sort of progressed. So again, the stakeholders were not really coming together, or some of the stakeholders inside the decision-making process were having a bigger say than others. So the communication was a bit of a problem, hence why we then come to the third point of input development, where there was lack of inputs, where the communication building was not two-way, and again, decisions were not really taken in a holistic manner. And again, finally, the throughput development process, again, is where something similar to, I would say, the stakeholder involvement, where some of the initial promising things that happened were not continued. For example, the vaccination process, which happened quite smoothly in Sri Lanka for the first round, unfortunately, when it came to the second and third round, seems to have lost its way again due to numerous reasons. So again, people, or the general public rather, felt that this continuation was missing, and again, that had a negative impact on how they perceived the government and the policymakers to go ahead with the other crisis. It got to a level where when it came to the third vaccination process, many people were hesitant because they felt the government was, for example, getting some kinds of vaccinations from different parts of the world that was not regulated, and people really have lost that link or the trust component that they had at the very beginning of the process. So again, this is quite interesting for us to look at. And again, when we were to sort of combine this understanding with the survey instrument, I think some of the interesting things that we saw was that, especially when it comes to the sort of demographic variables, again, in particularly gender, females did perceive that they felt that some of the decision-making processes, some of the messages that was passed on by the government was to be trustworthy than the males, which we found quite fascinating and quite interesting. And again, I think this was also due to the certain job roles and the threats that they had. Again, the men were sort of exposed to greater threats in terms of their job roles. And again, that was something that we found to be quite interesting and obviously needed to do further exploration. So in terms of sort of the discussion points that we had with this particular study, one of the main things that we were able to identify was that the public was keeping a very close eye on many of the things that was happening. And again, I think this was the case with many countries. Again, the pandemic, when it sort of happened in 2020, I think no one really expected that level of a magnitude for it to sort of have that level of devastating impact. So again, every decision was sort of scrutinized and people were paying a close attention. And again, a very strong sort of discussion point that we were able to pick on was the stakeholder involvement in the decision-making process. And again, especially for dimensions such as legitimacy, where the government is able to really establish its trustworthiness, there needs to be sort of a strong message sent by the government or the policymakers that decisions are being taken in a collective form, and decisions were taken with the right experts giving their right amount of opinions for the decisions to happen in a successful way. I think that was very important. And again, with other dimensions such as input legitimacy, again, the findings did demonstrate, again, the lack of consistency. And again, there were very similar situations in other cases as well. Again, this again shows that the continuation of certain dimensions was not happening. And although we say that legitimacy and capacity are two dimensions that really build the policy implications for governance, the continuation of such dimensions in a long-term way or in a sustainable way seems to be lacking in the case of Sri Lanka, which again sort of corresponds to some of the findings from other places, such as even the developed countries such as Norway, that has also done something quite similar in terms of the pandemic. And again, for this level of stakeholder involvement to happen, I think one might also need to understand that the information that is being passed on and the transparency of the information needs to be quite clear. And this is where I think the legitimacy angle comes in. Again, the findings did demonstrate to us some interviews that people never trusted some of the numbers the government was giving. And again, this was quite problematic because as from the moment the trust is not there in terms of the numbers or in terms of how the government tries to sort of maybe in certain situations hide the real impacts of the pandemic, I think that is quite problematic for some of the decision making in the process. And again, the sort of females sort of believing the pandemic was controlled to a greater extent, again, sort of corresponds to some of the findings. Again, the gender inequality attitudes towards the COVID pandemic sort of relating to some of the occupations, I think was quite interesting, which again needs a greater exploration. Again, this is where I think we have now gone in terms of our second study, which is currently in the process as we speak. So again, since this was the very first study that was conducted, again, the study was obviously exposed to quite a few limitations. And again, as I said at the very beginning, this was a convenience sample that we used. And again, there is sort of obviously doubts in terms of some of the understandings and ideas that were coming through. And as I said, because the sort of area in itself is quite novel, and again, since most of the existing work was based on empirical narration rather than actual theoretical basis, again, this is the sort of awareness that we have. Hence why, in terms of the study that we are doing now, we've obviously expanded on the sample basis to make it a bit more comprehensive. So the study that I'm presenting right now was that very initial study, which was obviously done with that very small sample to get that initial understanding in the South Asian context of Sri Lanka, which was not seen before. And again, the resilience building angle that we were trying to propose at the very beginning was coming out quite strongly in terms of the interviews. And again, this needs further attention to see whether this could be actually sort of a concrete concept that is coming through. If that's the case, I think this is quite good work, because we could then use this as a tool for more providing sustainable solutions for some of the governance mechanisms and the sort of ideas that are being presented by many of the policymakers. Right. So in conclusion, what we sort of looked at was again, legitimacy and capacity were identified as the two main mechanisms that we were sort of building this understanding on, and how these variables could assist the development of resilience. And again, both the qualitative and quantitative findings do point out towards some of these interesting sort of themes that were emerging. And gender was, we can say that it was a moderating variable based on the findings. And again, this sort of obviously needs further attention to see whether this could be the case. Again, already evidence does exist especially in the Western context, but I think there is more room and more scope to see whether this could be the case in the South Asian context, where obviously there is other issues such as gender equality and things that are coming through as well. And again, I believe strongly if there is more research to be done on resilience building, especially if you are to look at the pandemic situation as a policy building or resilience building platform, I think governance capacity and legitimacy needs a very strong theoretical building. And I think there needs to be a great attention paid, because based on what we can see at the moment, I think we can say that it is almost being overlooked when you look at resilience building, where most of the focus has been on the organizations or individuals, where the policy side of things is almost sort of people take it for granted. So I think this is where further work could be expanded on this area. So yes, so I've linked the link towards the full article, and I hope that was not too short, Dr. Christian. Try to keep it as short as possible, and I would welcome any questions and any suggestions that you have. And thank you very much. I hope I have not bored you for too long with this. Thanks.
You didn't bore us at all. Thank you so much, Isuru, for that lovely presentation. I found it very informative, and I found it very useful. And it wasn't short at all. I think sometimes when you talk for like 15 minutes, you lose people's interest. But in your case, it was precise and concise. So well done. I think Iena is clapping and also asking, going to ask you a question. But either way, thanks. I think it was very elaborate, great slides, great presentation. It was apt, but I will let other people ask you questions before we go. So thanks, and Iena.
Hi, everyone, once again. Thank you so much, Dr. Isuru, for that presentation. That was a beautiful one and a great slide, like Christian has mentioned. So my question, you've touched some light on this question, but I just want to know, during the study with you and your colleague that you did, was there any comparison with other countries and how they were able to mitigate, how did they manage crisis that Sri Lanka, the country in context, in case maybe something else happened? Of course, anything could happen, no one knows. Did your research, did you go further to really do a comparison? And also, my second question, sorry, is that could population of Sri Lanka have any effect on how the government could have managed crisis? And the third one, which is, it's kind of, will I say, it's fascinating to me that women were the one who trusted the government most in Sri Lanka, because that's not in other countries. In other countries, women felt they were not supported at all. And so listening to your presentation, I'm like, really? Oh, that's really nice. But my question now is that, could it be, and I know you want to do a further study on that because it's very fascinating. Why would women be the one to even trust the government more? But could it be that the sectors you had used, there are more men who work in that sector, and maybe very limited number of women, and maybe that could be the reason? So those are I hope I didn't ask too many questions.
You said two, but you went to three. but either way, I hope you can recall. I think those questions are very great questions. So, Isuru, I hope you can recall the three questions.
Yes, sure. Yes, thank you very much for those questions. Yes, so again, when the study was firstly discussed, actually, what we were proposing was that we were trying to do more of a report to the government, where again, there was no comprehensive report that was done to the government in terms of how the pandemic situation was done. Again, when we were looking at this at the very beginning, as you rightfully said, most of the work that was existing was purely from context specific. As I said, we looked at a few studies such as the Norwegian one and also the Pakistan study, which was also looking at sort of governance capacity and legitimacy building. However, the way in which different countries went about dealing with the pandemic was completely different in Yeni. So again, we had to look at different countries and looked at, okay, when we were picking countries, what were the countries that were sort of coming out? And again, the UN published quite an interesting report at the very beginning of the pandemic, where they identified several countries which were able to really use certain strategies, such as, okay, how they could prevent or identify potential COVID symptom holders at the very beginning through airport check-ins, through other processes. So there were certain countries that were able to really mitigate the threat at the very beginning. Obviously, after that, things did spread eventually, but this was where I think we were able to sort of pick Sri Lanka as one of the countries as well at the very beginning. So I hope that gives some kind of context. And again, when you look at the sectors, as you rightfully said, yes, the sectors that we have picked are predominantly in the Sri Lankan context as well. we see men sort of dominating, but again, sectors like IT, it has now changed actually, where actually females do come in quite strongly again in parts of Sri Lanka. As you said, again, I think the only problem we have with this study is that because the sample size is quite small, we couldn't really say that, okay, in IT or in other sectors that this is actually the case. So I think that is where work needs to be done. And when it comes to females and how they sort of trust the government, again, I think there are certain links to culture as well, where generally the government is considered to be more trustworthy with public generally. But again, why men don't trust the government as much as women? Again, that's because of the exposure they have and the interactions that they have with the different individuals and stakeholders, whereas females, again, in the context of Sri Lanka, are still not exposed to this level of networking or this level of they might be still working or they might be still in employment, but they still don't have the networking maybe many of the men have in terms of the formal and informal networks. And again, this is something I'm saying through experience, but I think this is where we are still working on to really identify what is the case, because as I know, when it comes to the Western context, that's not the case at all, where females don't, I mean, there's no sort of a gender bias when it comes to whether information could be trusted in that sense. So I hope I'm able to give you some sort of an answer to that in that way.
Thank you.
Thanks very much, Ian, for that. And of course, thanks, Isuru. Then we have Wojciech.
Okay, so I don't know much about Sri Lankan politics, yeah, but I remember that in 2022, essentially there was a mass revolt against the government, which was also a mass revolt against the opposition, who a lot of the protesters actually saw as an equal waste of oxygen, yeah, in the parliament. And when you think about, so in one of your first slides, you had this sort of like chart which kind of showed that legitimacy and capacity as two preconditions for resilience building, yeah. So could you clue us in a bit about whether the Sri Lankan government at the time of COVID 2022, because, you know, it takes a while to break an economic system, as anyone who's been through a neoliberal crisis knows. So I was wondering if the Sri Lankan government in 2020, when, you know, everything kicked off, sort of, whether they were already lacking the legitimacy in the eyes of the public. So essentially, no matter what they do, and if they stood on the head, people would look at them with a skeptical eye. Because when you think about, compared to a Western example, for example, the UK, global financial crisis, the UK government created conditions for that, yeah, because of an overly deregulated financial system that resulted in a massive surge in sort of like critique and rebellion against, you know, the traditional forms of government, yeah, which gave us the greatest economic self-mutilation of the 21st century called Brexit, and brought some complete lunatics from the fringes of the Tory party into positions of leadership. So when you think about it, when we got to the pandemic in the UK, we had people in power who a lot of people would not give legitimacy in the first place. So it probably wasn't a surprise to us that the initial response was basically a bunch of lads playing beer pong. Whoever loses takes the fall for it. Was that also the case in Sri Lanka, that the government was already sort of like on thin ice in terms of its legitimacy? So whatever it would do, the public would be skeptical of their actions.
Yes, Wojciech, thank you very much. I think that's a fantastic question. I think that you dived in to really well, because that's a question most of Sri Lankans have, and I think I'm really happy that you are able to really bring that out and that you know that much of detail about it. Surprisingly, I think Sri Lanka is quite a funny country. We always say that people tend to forget things very quickly. Again, there was a certain government that was overthrown due to things such as nepotism, but then 2-3 years down the line, they were elected. Again, they came into power. They got the highest number of votes in history. So in terms of the COVID pandemic, when it struck in 2020, no, actually the government was, that was just when the government was appointed, the new government, again, that was again overthrown after some time. So it was the period where they were at their strongest, I would say. People had a lot of trust in the government in 2020, in the beginning of 2020, in terms of what they were doing. And actually, after the first round of the pandemic, in terms of how they control, and as I said, Sri Lanka was one of the countries which took some measures at the very beginning. I think they had things like airport check-ins of the pandemic or virus, like probably the beginning of 2020, which was not seen anywhere else in the world. So they did have everything going for them. And the COVID pandemic and sort of them losing legitimacy and the economic crisis, I think those are two different timelines. It's not really sort of crossing paths in that way. But what happened with the second or third round of the pandemic was that the information that was given was not there. Again, there was different issues. It was not purely the political crisis, but also different government officers, different parties sort of not really doing their job as well, and people lost trust. So again, I would not really use sort of cross paths with that, with the crisis that happened. I think those are two separate incidents. And again, I hope that gives some context. So they were not walking on thin ice at all, Wojciech, at that point. In fact, it was the complete opposite. They were actually at the strongest point in their history they've ever been, to be very honest. Yeah.
Okay, good. Thanks, Wojciech, and thanks, Isuru, for that. I think Wojciech was trying to relate to the challenges that the UK is currently facing, and I think a lot of people can relate with that. And it's great, Isuru, when you also say that the political dynamics in Sri Lanka is quite different from what we have in the UK. Any other questions for Isuru? Okay, for me, one of the things I wanted to find out briefly, of course, I loved your presentation and the fact that you were looking at resilience, and you were looking at resilience. So your definition for resilience from the economy, isn't it? So more like economical resilience. But when you talk about resilience, I've done some work on resilience, and we looked at it from supply chain. So the whole idea of resilience, how resilient can supply chain be? And I think it was 2 years ago, really, and we published something on the supply chain resilience within the NHS. So similar to what you're doing, how COVID-19, how the NHS was able to cope with the COVID-19 pandemic, and was looking at it from that resilience perspective. So it's great. One of the things that we also noticed, especially within the UK, was the inconsistency government policy, like you said. So I think in the UK, one of the things that we noticed was the government was saying something else and doing something else. Clearly, we saw it with the leadership and also even within the PPEs. So you can see in the hospitals, they were changing the rules, changing the policies to suit the correct or what was happening at that moment. So for me, when you talk about inconsistent government policies, what are those policies that were inconsistent you're talking about? Can you just give me examples of those inconsistent policies that you feel that the government was putting forward that didn't work within Sri Lanka?
Yeah, Dr. Krishnan. So again, at the very beginning, what they did was they said that, for example, things or the sort of steps that they're taking for the pandemic are not going to be political. So they had experts coming in from different parts, especially doctors. Again, the armed forces of Sri Lanka was utilized mainly to ensure that people who were sick were sort of guided to the quarantine centers and everything was in control. The law and order was maintained, things like that. Unfortunately, as things progressed, the political arms or the sort of political powerhouses were able to sort of dip their feet into the entire system. And that's where I think the strategies or the decision-making process was inconsistent. For example, when they said that they're going to issue the sort of vaccinations, certain different people were getting vaccinations much earlier than others. Again, the sort of system in which you are supposed to go and get certain other assistance when you are sick were not in place. Different people were obviously being treated in different ways. And this is where, and again, the media in Sri Lanka is also being politicized, where certain medias are sort of far right. So again, this is where people were starting to wonder whether this information that they were getting or the numbers or the sort of real depth of the issue was really shown to the public, and this is where panic and frustration and anger sort of started to creep in as it progressed. And by the time it got to a stage of, in fact, the third vaccination process, something really funny happened in Sri Lanka, where the government endorsed a miracle syrup that was done by some random guy who has never studied anything to do with medicine or anything. And then the government, in fact, the speaker had this portion, and I think he got sick as well. So it's quite really funny and quite stupid, I would say, to a certain extent, to sort of make people believe in some of those things, whereas obviously you are supposed to go with the research and the findings that are coming globally, where people are said to be using the vaccinations as the main way to control things. So yeah, things like that.
Because I was quite surprised and when you said that a miracle or magic syrup was endorsed in Sri Lanka. So I don't know, because I've not been to Sri Lanka before, but to be fair, is that the tradition of becoming a pharmacist, or I used to be a pharmacist, so I have a clear idea of how medications work. So is the traditional medicine side of Sri Lanka, do you guys really believe in traditional medicine? Because with traditional medicine, they have a different way. So it's not like the FDA, how it's done here. So maybe that magic syrup you're talking about might not really be like that magic syrup, might be that kind of pharmacognosy, traditional medicine, herbal medicine, that maybe they have I don't know the system there where they're able to say, yes, these are the kind of things. So I don't know, maybe you can explain better, but of course, definitely, it's quite different from what we had here. We had different vaccines, and we had to go through all that process before we had rollout. And it's unfortunate that from what you have said, it looks like there was a political undertone in the sense that those that are more influential were the ones that were getting the vaccines faster or better. To be fair, I'm not in Westminster, but one of the things that they did was there was an age rollout. So it's there with the elderly. So I think one of the things, and that's why I'll be happy, and I think you've said it already, if you could do more comparisons with other countries. So maybe how did the G7 countries, how did they cope with the COVID pandemic? Maybe there might be things, there might be similarities, and of course, there will be differences based on your magic syrup. So maybe you want to provide more context on that.
Certainly. I think Wojciech gets a question.
Okay, Wojciech.
I find it really interesting that the Sri Lankan government kind of went from good response to we lost our legitimacy and we dropped the ball. What do you think? If it's not in your data, yeah, because like you said, it's it was the initial sort of like preliminary study. But as a Sri Lankan, maybe, why do you think there was such a reversal where a very effective policy start to combating the pandemic ended up in measures which were half-baked, ineffective, doubted by society? Like you mentioned, miracle syrups aside, the US president encouraged people to drink bleach, which actually the company that produced the specific brand had to declare on Twitter that it's not to be used in any circumstances internally. But, that was, the US never really got to a good start. And a lot of countries that got to a bad start kind of got better in the way. It's a kind of a unique case where you kind of did a reverse Western world almost. Why do you think that happened? Because it's quite interesting in that way.
Yeah, I think, as you said, Wojciech, I think they got off to a fantastic start. As I said, when the pandemic hit, it was actually, this new government was established in 2019, November. They came into power with, I think, around 6.9 million, again, a record vote for this president. And again, by the time the pandemic hit, they were at the best in terms of their public relations, everything. And they did pretty well at the very beginning. I think what really happened was that I think the financial issues were sort of starting to creep in. Again, one of the things that is not related to this in Sri Lanka is obviously Sri Lanka is a country that is dependent. I think they get around 4 to 5 billion USD out of tourism. And I think that was their buffer for the country's obviously economic to roll out. And while they were controlling the pandemic, let's say to a couple of months down in 2020, I think the cash flow was starting to get hit quite significantly because the tourism sector was damaged, obviously, and then they had to also spend quite a lot of money to give the people who were finding it difficult. I think Sri Lanka has around 70% of the countries are in the informal sector. So people were losing their jobs. Again, the government had to provide certain funding. And at the same time, the government also had to spend on vaccinations. So I would say this sort of triple course action that was sort of affecting the government made them panic internally, although they never showed. And I think that's where they started to make some of these really irrational decision-making powers, such as things such as endorsing other things, sort of making people sort of deviate from the actual process. And I think after some time, people realized, look, I think the government is just not really doing what they're supposed to. And I think the people never found out that the main reason behind this was the economic difficulty. Again, that's where that bubble burst in the next year, where it led to something we call the crisis in Sri Lanka, and everything was sort of taken over. So I think that was the beginning of that sort of crisis, if I was to analyze it in that way.
Thanks very much, Isuru, and also, of course, thanks very much, Wojciech. I like what you said, Isuru. You can see that for many of the countries, you can see that the pandemic, the COVID-19 pandemic, has led to this economic recession that many people are going through. So most of the crises, that the inflation and everything, everybody is saying it was a result of the pandemic. Either it was the overspending or not even spending at all, or the fact that it affected several sectors like the tourism sector, the health sector. It has led to a bigger crisis, and it's great that you've been able to provide more insights on that. So any other questions for Isuru? Any questions, anything you want to ask, any comments, any feedback for Isuru, anything you want to ask him? He still has some few minutes. If there's any burning question you want to ask Isuru, any questions for him? Like, everybody just liked what Isuru has said, isn't it? Nobody wants to ask Isuru any questions at all. It's great, it's fascinating, and thanks everyone. It's fascinating, of course, what you've said. And it's great to see how these policies and measures have been put in place. And hopefully, I can see the article there, so please everyone try and read Isuru's article. And for what Isuru is saying, there are more studies going in place, isn't it? To try and expand on this work, because it's a good work, and I feel there's a lot of things you can do. Of course, one of the drawbacks of the work, like you said, is the limited number of interviews that you had, and looking at across sectors. I think it was Nyede that said maybe the reason why your findings were more reliant on the fact that women were maybe in the government, because of maybe you had more men and few women. So maybe having a bigger sample could be good, looking at other sectors, looking at other nations as well, because it's a this COVID, the pandemic, lessons to be learned is not going to end, because we need to learn those lessons. So hopefully people will read your work, and you would expatiate much more with your researchers and scholars concerning future studies. But thank you so much, Isuru, for the great presentation. We found it very insightful. Thanks everyone for attending, and thanks everybody. I think this was a bang, really. We started 2023 with a bang from Isuru, looking at crisis. Hopefully, we won't need to manage so much crisis. But if we need to, then of course, you know the person to meet Isuru. He will tell you how to manage crisis going forward. In the next 2 weeks, we'll have another seminar. So watch this space. You already know it's bi-monthly. So next 2 weeks, you have an external person that will be coming to tell us much more about another research. So watch the space, and it will be advertised very soon. So if we don't have any questions, then have a nice week, and thanks everyone for attending, and see you on the 25th of January. Thank you very much.
Thank you,
Bye,
Ron.
bye everyone.
Thank you.